In Chapter 13, we're going to discuss chest, abdominal, and pelvic injuries. To begin with, chest injuries can be open or closed. Anybody that has a chest injury must have their airway, breathing, and circulation checked and rechecked because a chest injury could involve the heart, the lungs. So a responsive person should sit up or be placed with the injured side down. There are closed chest injuries where the skin is not broken. Rib fractures. So the upper four ribs are protected by the muscles, the shoulder blades, the collarbone, and then the floating ribs have freedom to move. Broken ribs usually occur along the side of the chest. Usually what you'll see is somebody is guarding their side or holding it with their other arm on the opposite side of their body. And they may have a sharp pain when they breathe or cough or move in any way. It can feel tender and their breathing can be impaired. There may even be some bruising over the injury. Help the first person find a stable, comfortable position and stabilize their chest. You can give pain medication, but make sure they're taking very slow, deep breaths and call 911. There's something called a flail chest, and what happens is there's paradoxical chest motion. That means the chest is moving in a way that it shouldn't. So the usually involves some kind of abnormal breathing, so there must be some type of injury in the respiratory system. It's very painful, difficult breathing, bruising over the skin can occur, and you'll have the same signs as you do with rib fractures. Don't apply the constrictive bandages around the chest when you're suspecting a flail chest. Just call 911. Open chest injuries are when the skin has broken, and one thing is called a sucking chest wound. What you look for is blood that is bubbling out of the chest wound and a sucking sound during inhalation. Leave the wound exposed to air. Do not cover unless you're using a direct pressure and a dry gauze dressing to control the bleeding, and make sure you call 911. If there's an impaled object in the chest, obviously you can see that. Stabilize the object in place with a dressing and call 911. Abdominal injuries can also be open or closed, just as chest injuries, and can involve hollow and solid organs. Hollow organs, when they rupture, they spill the contents of the organ into the abdomen. Solid organ rupture results in internal bleeding. If it's a closed abdominal injury, that can occur when the abdominal tissues are damaged, but the skin is not broken. You can examine the four quadrants of the abdomen gently, pressing on them, and just see where the injury might be. Look for bruises, pain, tenderness, muscle tightness, distension. If the person is unresponsive, place them in the recovery position, and if they are responsive, place in the side lying position and call 911. An open abdominal injury, the skin is broken. It could be a stab wound or gunshot wound. Stabilize the object against movement and control the bleeding by placing dressings around it and call 911. If there's a protruding organ, have the person stay in a comfortable position with legs pulled towards the abdomen, cover the organs with a moist, clean dressing and call 911. With pelvic injuries, fractures are usually caused by falling or a motor vehicle crash. When my son was younger, he was in a car accident and was hit by a drunk driver, and he broke his pelvis. And as soon as he was in the ER, they checked his pelvis by pressing a little bit downward on the top of the hips, and he was in immediate pain. So they knew right away, without even taking an x-ray, that there was a fracture. So pain in the hip, groin, or back that increases with movement, inability to stand or walk, or signs of shock are all what you should look for with pelvic injuries. Call 911, don't move the person, keep them flat, and treat them for shock. So that is the end of chapter 13 on chest, abdominal, and pelvic injuries. Again, look through chapter in your book and any other ancillary materials that are included in Blackboard to help with learning, as this is just a quick outline and overview of the chapter.